We are live.
Right. So you know I'm nosy. Will I see people's questions?
If you're looking on your phone,
Okay.
yeah.
Let's not look at the phone.
All right. Hello, Fab Squad. It's Dr. Jamie here, your lifestyle pharmacist, and it is time for another episode of Live with the Fab Squad. Yay! Happy Sunday, everyone. I'm so super geeked up and super excited about this edition. We have one of my favorite women here with us in the Fab Squad, Dr. Audrey Townsel. I'm going to let Dr. Audrey introduce herself. But before we do that, I want to let you all know what we're going to be talking about. So this is one that you all have been wearing me out about with all of your mental health questions and just with the state of the world right now, you know, how you're coping, what you're doing. And so mental health is not my area of expertise. I do have a mental health story, but I wanted to be sure to bring in an expert to tackle this topic for us tonight. So we're talking about something that we need to do all the time anyway, regardless of COVID-19, and that is creating and maintaining boundaries, right? Yes. And the way that I titled this episode is going to make it a little extra fun since Dr. Audrey is here. So it's called Creating and Maintaining Boundaries in the New Normal. And Dr. Audrey is going to share some things with us about the word normal when we get into this conversation. So before we go too far, for those of you who are already here, make sure you hit that share button because we want to make sure that your friends, your coworkers, your neighbors, your church members hear what Dr. Audrey has to say. So go ahead and hit that share button right now. All right, so that's it for me. I'm Dr. Jamie Hardy, your lifestyle pharmacist. Hopefully you all know who I am, but for those of you who may be tuning in for the first time because you're coming to hear Dr. Audrey, welcome, welcome, welcome. I'm just gonna tell you who I am really quickly. I'm a board certified pharmacist, a speaker, a best-selling author, a media expert. And what I do is I help women to be fit, fabulous, and fulfilled without prescribed pills. So through my best-selling books, my online lifestyle academy, my fabulous and fun events called the Fab Gathering, I give you tips and tools to put those things into practice so you can live your very best life. So that's who I am. But let me get out the way. We have someone very special with us. Dr. Audrey, tell the people who you are. Give them an intro.
I don't have all of that going on. I don't have books and all. I'm just kidding. But so very proud of you, Dr. Jamie. A lot of people don't know that we go way back to like elementary school, and we went to college together as well. We're sorority sisters. So been knowing each other for a very long time, and I'm super proud of you and, you know, always willing to help in any capacity for you. But again, I'm Dr. Audrey. I'm a licensed clinical psychologist here in Memphis. I'm the owner of Kalik Psychological Services, which is a private practice where we have full services. And our goal is to partner with our clients on the journey of healing mind, body, and spirit. So we encompass the total person in our journey to healing using a lot of cognitive behavioral techniques, a lot of different methods that I use with my client, depending on what their issue is. So love doing what I do. You know, I always talk about multiple streams of income, so that's not all I do. I am a regional vice president of a correctional healthcare company as well. I manage 86 contracts across the Midwest where we care for the lives and the mental health of our incarcerated individuals. And I'm also a mommy, so I'm a mom of a 8-year-old. So that definitely keeps me busy.
Wow. I love how you said taking care of the whole person, mind, body, and spirit. And it's wonderful that in the mental health space, you have taken this more, you know, holistic or caring for the person in totality and not just in a silo with just their mental health, you know, over to the side.
Right. You know, the first thing I ask my clients is part of their intake screen, and I ask them about, you know, their medical conditions, what medication they're taking. I ask them when was the last time they got a physical. We talk about what you're eating, what you're drinking, how much sleep you're getting, because all of that impacts your mental health. I mean, you could just think about when we were in school and we did all-nighters and we stayed up all night trying to cram and study. You know, by the end of the next day, we were grouchy, you know, we were worn out, we probably felt sick. All of that affects your mental health as well. You know, the analogy that I use is, you know, our brain floats, it's supposed to float in clear fluid. And the only way to get that fluid clear is to get the right sleep, to get the right nutrition, making sure you have adequate water intake. But if you don't do that, it's almost like your brain is floating in muddy water, right?
Wow.
And so have you ever tried to walk in muddy water? Like it's hard, like it's almost impossible sometimes. And so just imagine you coming to me as a client saying, okay, make me feel better, but your brain is floating in muddy water and you're trying to say, okay, fire neurons, like make sure I concentrate, make sure I get up on time, make sure I'm happy. Like it's impossible. So you have to make sure you're taking care of your entire body, not just focusing on one part of it.
Fab Squad, you heard that. Water, nutrition, adequate sleep. Boom.
Absolutely.
Okay. All right, Dr. Audrey. So let's go ahead and get into this whole normal or not normal thing, right? So since the title of this session is creating and maintaining boundaries, you know, as we navigate going back or not going back to the world as we once knew it. So people are referring to this new world that we're going to go out into, you know, in the wake of the coronavirus as the new normal. So educate us about why, you know, utilizing that term normal may or may not be what we need to be using.
Yeah. So, and this is just my personal opinion about the word normal. And I know people have their own impressions of what normal means. But I think normal is so subjective that for me, it's impossible to say what is normal when you talk about the masses. When you talk about, you know, all the population in general, it's very difficult to say what's normal to you may not be normal to me. And when I think of the word normal, I think of, you know, one of those words that has a polar opposite, like left, right, hot, cold. Normal, the opposite is abnormal, right?
Yeah.
And so that means right or wrong. So just because you think it's normal doesn't mean that it's right or wrong. It's just that you think it's normal, right? So to me, it's too subjective to say what's normal. I try to steer my clients away from words that carry emotional weight, because if you think about it, if you're struggling with something and you say, oh, that's not normal, it makes you feel a certain way, that you feel like you're doing something that's not normal or what everyone else is doing. So that's kind of why I try to stay away from words that are either subjective or carry a lot of emotional weight with it, because it can make people feel like they're being judged. And so that's when you said that, you know, let's talk about normal. And I was like, what's normal?
What is normal?
What is normal to you may not be normal to me.
That's true. And as you know, and as clinicians and, you know, people that have taken an oath to care for others, you know, the goal and the responsibility is to be objective. And so I like what you pointed out about normal being subjective, and it doesn't allow us to bring that objectivity to our, you know, assessment.
Absolutely. And mental health is not a specific science where we can take a test and, like, you know, you could take a COVID test and you can say, oh, this person has, you know, the virus, I can see it in their antibodies or whatever. Mental health is not that. So it's not very, it's not very concrete where I can say yes, no. We use what people give us to make diagnoses. And sometimes I know we look at things and we diagnose based on what the masses would do, but I take each client individually. If that works for you and it works for your family, it doesn't make it abnormal because it works for you. So that's kind of why. Yeah, that's kind of why I choose not to use the word new normal.
I like that. So here's something that's coming up quite a bit, you know, now that here, especially in Shelby County, you know, I have been, and this is my opinion, everybody has their own. I have been very pleased with the way that data is being used to drive what we do here, right? So we're approaching the re-entry or the reopening of businesses and just society, in our area in a phased approach, right? So now, people are seeing these emails that come out from the mayor's office about the different phases. So with that being said, this is like graduation season. Shout out to all the class of 2020 high school,
Congratulations.
College, professional school. Congratulations, y'all. And with that being said, like people want to get together and celebrate and gather, and maybe not inviting the whole block or the whole, crew, but definitely with, their families. And so I've had a lot of people reach out to me, just asking for my opinion, and I can't tell you what to do. I'm just directing people to the CDC's website, the health department's website, and the mayor's website, right? And you all decide on your own.
Right.
But people are struggling, Dr. Audrey. They're conflicted. They want to celebrate, but they don't want to do the wrong thing. And especially for the ladies in the Fab Squad, where their house has always been the gathering place, the gathering spot. And now that people are getting out, people are kind of like inviting themselves over to people's houses because we always go to mama's house, or big mama's house, or auntie's house. Right. And people are being pressured to open their homes up to host again. So how can we help these women who are really conflicted and struggling, wanting to say, whoa, I'm not ready yet, but they don't want to let the family down because the expectation is that everything is at their house.
Right. Well, and I can tell, I struggle with this personally, right? When COVID, right in the beginning of COVID, my cousin passed away. And so I made a decision for me, because everything was so new, me and for the health of my son, to not attend my cousin's funeral. That was a very hard decision because we're a close-knit family. But I think my family understood the reason why, and they knew I wouldn't just miss my cousin's funeral. But it was a very difficult decision. And so I had to do what was best for me, what I felt was right for me. And I would employ others to do the same. If you feel that it's right for you, that's something that you probably need to stick to your guns about, and just making sure that you follow through with that. I think the most part is a lot of people are afraid to set boundaries because they're really afraid of what other people will think. They're afraid of how people will react to them, what they would say to them. And not only that, some people feel that their opinions or their feelings may not even be valid or even important. And so those are things that, despite COVID, like those were things that most people struggle with anyway, or even being considered selfish, right? But I think we have to get accustomed to turning the yes machine off. And you and I just talked about this before we started. It's like at some point, like you have to run out of yeses. Like you have the machine is broke, it's down, out of order. You cannot say yes to everything, right? Yeah. And we also have to not make no such a theatrical performance. Like if you say no, like the sky is gonna fall down. Like no, it's not. Like it's gonna be okay. Like your family is still gonna be your family, right? Like you're not gonna wipe away the entire family history or the family tree because you said no. So I think just getting out of this mind frame, like no is like so catastrophic, like that nothing will go right after you say no.
After you say
no. That's something, right. That's something else that we really need to kind of hone in on. And something else that I personally do, I have what I call time spacers. Time spacers. So if you don't feel comfortable saying yes or no in that moment, just give yourself some time. Like say, let me think about it. Let me get back to you. Let me sleep on that. And then hopefully by that time they'll probably have forgotten about it. But if they don't, then you can, rehearse what you want to say to them when it comes back around, if you don't feel comfortable saying no in that moment. Yeah. But I think boundaries are a very difficult thing for a lot of people. But the one thing about boundaries is you have to know what your boundaries are. You know, I hear a lot of people, right? Yeah. You know, I hear a lot of people say, you know, I have boundaries. And I'm like, okay, so what's your boundaries? Like, so how do you know what your boundaries are if you don't know what you know, how to communicate them to someone if you don't know what they are? And you have to be very clear about your boundaries and not waver. And it's not a boundary unless it has a consequence attached to it, right? So once you're clear about your boundaries and someone steps over that line, there has to be a consequence or there are no boundaries. Like that, you know? So if you tell someone don't do this, or, you know, I'm excommunicating myself from you, but they do it and you don't do it, then it's not a boundary, like, because you just let them do it. So you have to be clear on what your boundaries are so that you can communicate those boundaries, and it has to be attached to some type of consequence if your boundaries are crossed.
Wow, I love that. And, you know, as women, there has been this struggle to say no and to, you know, create those boundaries and really letting people know, because I love what you said, knowing them yourself and being able to articulate them and then holding people to them. Like if they cross it, they have to know you have a boundary.
Right.
And then when they cross it, after you tell them that's your boundary, there has to be a consequence. Oh, right. I love that. Right. Come on.
And you cannot have expectations about what people are going to do when you state your boundaries, because I know a lot of people, you know, they rehearse this whole scenario in their head. I'm going to tell them this, and then they're going to say this. No, you can't control that. So once you communicate your boundaries, it's about you communicating what your needs and wants are. It's not about what that person is going to give back to you or what they're going to say in response. Because if that's your objective, then it's not about you anymore. It's about getting a response and a reaction from them.
From that person.
And once that person responds, you have to give them the ability to do that. Just like you had the freedom to set your boundaries, they have the freedom to respond. They don't have to be okay with your boundaries. But again, if you have those consequences, they either have to respect your boundaries or you'll have to implement your consequences. And then they have the right to make a decision for themselves as well. But the key is that we don't take it personally.
Yeah.
So when someone makes a decision for you, for them to say, okay, your boundaries are not what I would want in my life, and they decide to leave, like, you can't take it personally. Like they've made a decision for themselves and they've set their boundaries as well. So you have to respect that.
Wow. And not setting your boundary based on the anticipated response of the other person. Absolutely. It's about you, not them.
Absolutely.
Okay. All right. So we're stressed and anxious, you know, as humans, just anyway. Right. But of course, the coronavirus has kind of exacerbated or kind of like blown all of that up. So what can women do who are recognizing that, okay, yeah, things are different with me. I feel different. I don't feel, you know, that I'm in a good space right now. How do, once they have this moment of self, you know, awareness, you know, then what do we recommend for women to do next? What's the next step? Yeah, you're anxious, you recognize it, you're not at your best. So now what?
One, we have to sit with that for a minute, right? I heard someone say that this is not a crisis, this is a cleansing. And that resonated with me because, you know, I think for the most part, we've used all of the comforts that we've had in life as a distraction for things that we should have been taken care of anyway. And so now we're at a point where a lot of the distractions are closed. We can't get to them, you know, and so, or we can't even get to the office. Our businesses are shut down. So a lot of the distractions that we use, we can no longer use. So now we're forced to sit with ourselves. We're forced to deal with some of the things that we should have been dealing with even before this happened, right? So I think, you know, one, recognizing, you know, the need to just sit still and just get in touch with some of those things that are now coming up that you should have been, you know, taken care of, you know, before. And just really doing that, just really taking care of yourself and just identifying what things have you neglected so that you can now, since things are quote unquote slower, that you can actually take time out for yourself to manage those things. But another thing that you can do is really just be honest with yourself. I know a lot of us really have a hard time saying when we're, off kilter, when, things are not going the way that we would want them to go.
Yes.
But just really being honest with yourself and saying, I'm not 100 today. Like, I don't feel like myself today. And I think it's okay to say that to other people as well, being honest with them, because, people can feel your energy. They know when you're off. I tell people around me all the time, like, you don't have to remind me that I'm not myself today. They're always like, you okay? No, I'm not okay. Like, can't you tell I'm not okay? But for us, it's okay. I think we should give ourselves permission to let people know how we're feeling. But I think we also have to, again, set boundaries around that as well, because we don't want people, you don't want to use people as your sounding board and not think of the things that they're going through as well. There are licensed professionals whose job is to kind of help people sort through those things. I know, for a lot of people, it's always comforting to talk to someone that but again, you're not taking into consideration that they may be struggling too, right? But the fear now and the anxiety that you feel now, I think giving yourself permission to say this is a human response to change, and that's all it is. It's not COVID. COVID is not, what is really causing the anxiety. It's truly the change. A lot of us don't do well with change at all. Transition,
especially unplanned. Like, we didn't see this coming, right?
You're not supposed to see life coming, okay? Like, where did we get this idea that we're supposed to know what's going to happen tomorrow, right? But I think that's the comfort that we get in routines. That, like, if I'm in my routine, I know I got to wake up tomorrow. I can check my calendar. I know what phone calls I have. I know. But when things change, it's like, oh my gosh, like, what am I going to do?
Yeah.
But that's a natural human response to transition. A lot of people don't do well in transition and change. And so that's what causes the fear and anxiety, because it's this idea that I cannot control what I don't know.
I'm not in control. Yeah.
No. And a lot of people are afraid I'm not going to say afraid. They are in denial that we have control issues. Like, we all have control issues, but because control gives us a sense of security, because we know what to expect next.
Right.
So, a lot of people are, I don't have control. No, yes, you do, sis. Like,
you do.
Everyone has a little bit of control issues because it gives us protection.
Yes. Yep. Oh gosh, I love that. So you talked about the fact that we are slowing down, whether we like it or not.
Slowing down.
But we're trying to slow down. We're making more of an effort, I think.
Okay. I can go with that.
And so for a lot of people, their life is just so busy. Yeah. But busy doesn't always mean productive. And so I think I totally agree. And I think you hit the nail on the head. This totally resonated with me, by being busy and having our calendar set and, these activities that we, do daily, these conferences we travel to, all these things that we do, it gives us that sense of control. Right. And we feel, that we are able to navigate life better, right, because we feel in our minds, at least, that we have some control over what's happening to right. us and in our day-to-day lives, when we really don't, seriously. But I think that, that productivity is like a Band-Aid, right. And it's there to kind of just,
it's a distraction. It's a distraction, I like, again, I'm a stickler for terms and words, because they really mean something. Band-Aid means that it's healing. Like, I'm covering it, protected, because it's healing. No, it's a distraction. It means your eyes should be over here focusing on my mental health. but I'm over here and I can't, so it's actually a distraction. A lot of things that we were doing were completely distracting us from the things that we really needed to do. And I think we're now being forced to pay attention to some of those things.
Wow. I love it. Come on, that just helped me right there. Because I will go on record in a minute. I have been, busy and I've been very distracted.
Right. But it's something else that we talked about before. You mentioned to me about this idea of slow. I don't think that, I think we're talking about two different constructs. Like slow is talking about, speed and time. But I think a lot of people are experiencing an increase in work. Especially if for those who are working at home. So now we're talking about volume, right? So yes, maybe things have closed down. You're not able to move as much. And so you're slowing down, but the volume has picked up, right? So it's not like you're comparing apples to apples now, because you're talking about speed and versus volume. It's two different things. So even though like when you were asking like the question about, the woman who's slowing down, I'm like, I don't know that lady. Like, I don't know her. Sorry to that lady. I don't know her. Like, seriously. Because yes, I'm not able to leave the house. I'm not able to go. I'm not able to fly to my sites anymore. But I can tell you from the moment I wake up to the time that I'm going to bed, I'm like doing stuff. Like things are on my calendar. So it's definitely not an even swap.
Gotcha. And that's a great point, Dr. Audrey, because I have a lot of educator friends. I have a lot of friends that work in healthcare, a lot of friends that work in IT, and you are absolutely correct in saying that the volume is at an all-time high. People are completely like zoomed out.
Right. If I get another Zoom invitation, I was about to click no on this one. I was like, it's another one.
You said yes. But I love the fact that you demonstrate, it was a great example even for me, setting boundaries and not adding more things if that is not what is best right now, and being okay with saying no. I love you, sis, but no.
You have to learn how to say no. And again, I use this thing with my clients when they get really anxious about, setting boundaries. I say, and then what? You say no, and then what? And we talk it through, and they say, okay, then this will happen. Okay, and then what? So we talk our way through like all these different scenarios, and at the end, guess what? You're still living, you're still breathing, you still can do what you need to do, right? And the answer is right. So you just worked yourself up. Now you talked yourself down, and now you can go throughout. You can work yourself throughout that problem.
Wow. That's awesome. So this one is a question for the parents. I'm not a parent yet to a human. I have a fur baby. I have a new puppy. But parents give so much, and I know I've been on the receiving end of everything that my parents have given to me. But I have friends that are parents, and just hearing them talk about what their schedules typically are, it's like Kumon and dance and ballet and baseball, soccer, piano lessons, birthday parties and play dates, all those things happen in addition to their children going to school and with the homework and the projects. This is all their extracurricular stuff. So some of the parents that I know, some of my friends especially, have said, girl, I have enjoyed them doing all this virtual stuff. I'm not having to rip and run all over town. But of course, the children are like, I miss my friends. I want to see them in person. So what do you say to the parents who are trying to navigate this whole space of, do I go back to all of that with my child because they miss all of that interaction socially and in person? Or do we continue to do it like this? Because honestly, this has really been working well for our household. Being more virtual and closed off from so many, demands.
Right. So, for that, I'll have to say that everyone has to do what's best for their family. right? Everyone is not going to agree with one particular way of doing things, whether that's kind of removing themselves from a lot of those social activities or just going right back into them. So you really have to do what's best for your family. But in regards to your child, I think one, we need to have conversations with our children. I think for the most part, we think as parents that we just make the decisions and the children do it. But when you think about when we were children, they used to get us upset when our parents used to just tell us to do, and we don't have, a voice in the things that we're involved in. But I think, when we talk about distractions, sometimes as parents, we subject our children to a lot of different activities, not because they really want to, because it does something for us as parents. Right. And so we really have to be honest with ourselves in the reason why we're doing this, and not only that, like, talk to the children. Half of the time, the kids don't want to do all of that stuff. I can tell you now, like, my son is already like, I don't want to go to summer camp. Like, I don't want to go to sports. Like, so I'm like, what do you want to do? And he told me what he wanted to do. And I'm like, okay, we can do that. And so, it may be as simple as you just having a conversation with your child and saying, what are the things that you really want to do? And if it's just a matter of them wanting to interact with their friends, like, find different ways for them to interact with their friends. It doesn't have to be, the way that you would used to, interact with them in Kumon, or whether that be sports. Maybe they want to do something different. Just ask.
I love that. So you heard that, parent.
Now, so my son is like the mini Beetlejuice. Said his name too many times, and now he's walking in the door.
He's a little early because I was clocking the time that we thought he would make his arrival.
He's okay. He's going upstairs.
So here's another one, speaking about, families. And I know that each family is unique and different, and they have to decide within the, dynamic what's best for them. But I'll tell you, the internet has been ablaze, with people commenting on how the roles have shifted in the households during this, pandemic. Maybe the person that was going to an office is now working from home and is home more now. Right. So a lot of my friend girls are just so happy that their bae, their boo, their husband, significant other has been home and has been chipping in. Right. And secretly, I don't know if everybody will go on record and open up their mouth and say, oh, it's been so nice. I'm glad he's been stuck at home because he's helping with the laundry and washing the clothes and with the kids. But how do we, and I know it's going to be a conversation, but people are afraid to even, have these conversations with saying, I like the fact that you were here to help more. How can we, keep this going?
Okay. I mean, you have to get over that fear, because that's the only way that you would, you could address that issue, is to have open dialogue, to talk about your, your wants, your needs, your fears, your concerns about transitioning back into your regular lifestyle. But what I would want to really say is, be realistic about your expectations about what's going to happen in the future, because, I can tell you that I have cooked, cleaned more than I've ever. And I'm telling you now, when I get back to, flying and going back to my regular routine, I'm not going to be able to do it. And I understand that you like it, but it's not going to happen. Like, it's not going to work for me. But there may be some things I can do. So not only that, just being realistic with the expectations, but being flexible with what you can give and what you can get from your partner. Just being open to what they're willing to give. But one thing that I do recommend is, when you have these conversations, there's the thing that I use that's called stop, start, and continue. Right? When you're talking about things that you want from someone, things that you are expecting or needing from someone. So what are the things that you want them to stop, or what things they want you to stop? What things that you want them to start doing, and what things that you want them to continue doing? So that is an open dialogue, stop, start, and continue. But again, having realistic expectations of what they can do. versus, not them just saying, I don't want to. Well, can they actually do that? If I'm flying across the country, I cannot make 3 meals a day. It's going to be impossible. So think about being realistic about what your wants and your expectations are. And again, being flexible. Maybe they can't give it to you exactly the way that you want it or how they're doing it now, but maybe they can do it a different way. It's just a matter of getting the need met.
Oh, I love that. Having expectations that are reasonable and realistic.
Correct. So remember, stop, start, and continue. That is a great starter to that conversation.
Okay. Stop, start, continue. All right. Got it. So since we're on this relationship tip, so some people have been just, drunk in love, at home, just, oh, he's wonderful, she's wonderful. I've fallen deeper, and more passionately, in love with this person. While other people, not so much. They're looking across the house or across the table like, when is this going to be over with? Because I am about to lose it up in here with this person. So, couples are navigating this as well. And It's been good for some and for others, not so good. So what can couples that have realized through this that they are like fractured, that their relationship is very fragile and it has really been needing some work, but they had those distractions that we talked about. Now what?
Right. And so so your relationship just didn't turn bad when COVID hit, right?
No, it's been bad.
I know, right? So don't blame it on COVID. Like, poor COVID. So I think for the most part, again, taking a step back and just being honest with yourself and saying, okay, we had a lot of distractions going on. Like he or she was always at work, so we didn't have to interact or for us to even know that we had a fractured relationship. We didn't even notice that we weren't talking because we were doing so many other things. And so now that that's gone out of the way, now we're sitting here looking at each other. We don't even know each other really, right? Yeah. So one, just being honest about it outside of COVID, just being honest about the state of the relationship, and again, this is about communication. You have to sit and communicate about where you are and where you want to be and where you want to go as far as the relationship is concerned. I would hope that this pandemic does not fracture a lot of relationships to the point where it's irreparable, but we can't control that. But I think that if you take a step back and be honest with yourself and be honest with your partner and have really honest communication about what's going on and where you want the relationship to go, then you can start putting a plan together into how will you address those fractures in the relationship so that you can start to mend the relationship back together, or try to achieve that vision of what you want your relationship to look like in the future.
Oh, wow, I love that. Something that you and I kind of talk about, like even off the record, is just women especially making time and the investment in themselves for like self-care. And so when I was kind of preparing for this talk, self-care came up a lot, and I talk about self-care with my tribe anyway, but I was just so pleased that even in this landscape of creating and maintaining boundaries, this whole theme of self-care was resonating and permeating even that whole topic. So, of course, since people are home a little more, they may have found it, easier to settle into a self-care routine. But how do you, because I know you talk about the whole patient and even approaching this with your clients, how do you convince them or help them to get on this path of consistent self-care for their mental health?
Right. One, stop making excuses about time and stop saying what you don't have time for, right? But that's because people have they have identified self-care into one category, and they think self-care is getting your hair, nails, massages. but that's not necessarily self-care for everyone. So you need to define what self-care is for you. Because I can tell you getting my nails done is not self-care. It actually stresses me out. So that's not something that I want to do. I'm like, can you hurry up? I got somewhere to go. But you have to define what self-care is for you. And what that is what is it that you can do to kind of take you out of a situation mentally that's been stressing you out, to kind of help you calm down. It can be as simple as you listening to music, or making time to, take a longer shot, whatever it is. But you have to define what that is for you, because when you are comfortable with the definition of self-care for you, then you will make time for that. I know a lot of people journal. I don't tell all of my clients to journal. Some people just don't journal. It's not easy for them. So I'm not going to add an extra stressor under the category of self-care when it's not self-care for them. So when you have to really truly define what that means for you and make time to do that. And also to get out of this idea that it's selfish of you to take time away from other people and giving to other people so that you can take care of yourself, right? I think the prime example is we all are attached to a cell phone. At some point, I have mine right here. So at some point, you have to plug it in to get juice, right? To charge the battery. Because if you don't, it's useless. We need the same thing. We have to plug in, meaning that truly unplug from everyone else to plug into ourselves so that we can recharge our own batteries. Because if we don't, no one will be able to use our personal phones. We won't be able to use ourselves to help others if we're not charged ourselves. So instead of thinking it is selfish, it's necessary for you to even continue to help other people. So it's not selfish, it's a requirement.
I love that. All right, plug in, disconnect from others and plug into yourselves.
Absolutely. Absolutely.
And gentlemen, I keep saying ladies, but gentlemen too, because I feel like I talk about women all the time, but guys, this is for you.
They can be fab too. Hey.
They can. They absolutely can. They can. So since we're talking about, of course, mental health, it's Mental Health Awareness Month.
Absolutely.
How do people who have never seen a therapist or a psychologist or even a psychiatrist for that matter, they have had some time to sit with themselves, right? And now they're realizing that there's some things that I have been putting off, I need to work on, and I'm ready now. So how do they even begin that? I know telemedicine is available, but everybody doesn't know how to even approach.
Start navigating, right?
Yeah.
Right. Even before that, even when you talk about navigating the system to try to find a therapist, you need to even go a step before that and say, how do you know when you need a therapist, right? Here's my thing. If you have a hairstylist, if you have a nail tech, you should also have a therapist. My personal opinion. Because a lot of people think you should only go to therapy when something is wrong. That is absolutely incorrect. Because when you come to me when something is wrong, I now have to put the fire out while I'm trying to also, figure out what was the cause.
Yeah.
And then teach you the skills so that if it happens again, you know how to manage. So now we're doing triple duty because you waited until there was a crisis to come to find a therapist. And so when I do free consults and I try to explain to people, it's easier for me to help you build those coping skills when you're not in crisis. Because when the crisis comes, now you can use those skills and you can avoid the crisis altogether.
Avoid the crisis.
Right.
Avoid. Okay.
Right. So the best time truly to see a therapist when you feel like you're good, and now you can start, what you can do is you can start thinking about and talking about things where you were not good, and we can dissect those things to try to work on some coping skills. So if it comes up again, you would have a plan of action. So that's number one. a second thing you should also think about is when you need to find a therapist is when your friends and your families are getting burned out. Like when they are, you think you're laughing, but I'm dead serious. And when they stop answering your calls, or when they're like, girl, you still on this? Like, you still talking about this? Or, or when people say, are you okay? Like, are you sure you're okay? That means you're not okay. When someone is constantly asking you if you're all right, you're probably not all right. So knowing when to pick up those cues, right? When you have used things that would have worked in the past that don't work anymore, and they're not working now. So say you had coping skills that you just your go-to thing, you are a runner. So if you ran a mile, then you can get your endorphins back up, and now you're back on track. If that's no longer working, that's probably a sign that you probably need to seek someone else to kind of help you with that. When things are causing so much distress where it's affecting your relationships, your work product, when it's interfering with other areas of your life, then it's probably time for you to start looking at ways to kind of help deal with some of those things that's going on. Another one is when you are using destructive methods to try to cope. So if you find yourself, I know, I tell people, make sure when you get stressed, you already know your limit of alcohol before you start drinking. So if you already have in your mindset, like 1 glass of wine, that's it. Then when you start doing 3 and 4, and then you 5 and 6, then you need to pay really close attention to that, because that means that whatever is stressing you out or causing you distress is gotten to a point where your normal coping skill isn't working. And so now you're doing something that is actually causing you harm and is not really helping you. And really, but the most important thing is we know when we are off kilter. I know when I have an attitude. I know when I don't want to be bothered. I know when, I'm up. I know when I'm down. We know, but we just have to really be honest with ourselves and truly kind of hone in on our inner self and have those conversations with ourselves about what we're truly feeling in that moment, and knowing that help is available. And when we start to navigate help, one, if you're going to use your insurance, go ahead and call your insurance company to see who's on your insurance panel, and have some idea of what type of therapist you want. I have a lot of people who call me and say they chose me because I'm a woman, or they chose me because of I look like I'm a certain age, or they chose, different things. So you have to have an idea of what you may feel comfortable with, because this is a very intimate relationship you're going to have with someone. Like, you're going to tell your therapist things that you probably have never told anyone else. And I tell you, I'm the keeper of all secrets. You will never get anything out of me. But because of that intimate relationship that I have with my clients, I know that they feel comfortable enough with me and trust me enough to help them and partner with them on that journey to healing, that they can open up. And so you have to find someone that you're comfortable with, because you have to be very vulnerable with your therapist for it to work. And you have to be comfortable with them for this relationship to work. Another thing is ask people. I get a lot of clients from referrals. Some of my clients refer their friends, their family, co-workers, and they call me and say, such and such referred me to you, such and such told me to give you a call. So, ask people, who, do you like your therapist? Who would you recommend? And I refer a lot of people to other therapists as well, especially when I'm not taking new clients. But ask people and do your research. You need to really do your research in regards to how long they've been out of school, what are their demographics, what populations do they feel comfortable working with. I myself give free consultations. I give free 10-minute consultations, and that allows my new clients to ask me questions, because it's not about if I can pick them up or decide if they're going to be a good client for me. No, you need to decide if I'm a good therapist for you. And so it's an interview. Like, you need to ask me all of these questions. You need to ask me, what is my modality? Meaning that, what type of things do you do? Like, will you tell me to write in a journal? Will you give me homework? Will you just sit there and we just talk? Like, what are your modalities? So I allow people to ask me those questions. So you need to, one, check your insurance company, get referrals, ask other people about therapists, do your research, and also ask if they're able to give you a consultation before you even schedule an appointment with them, because you don't want to get in there and the energy is all off. And I've had that happen before, because I can tell you, even though I know I'm a good therapist, but I know I'm not for everyone.
You're not for everyone.
I am not for everyone. And I understand it. And I had to learn that early on in my career. I've been doing this for over 15 years now. I know that I am not everyone's therapist, but I can probably refer you to someone who can. But you also have to know when that therapist is not for you too, because you don't want to, get stuck in a relationship and thinking it's all you. It's all you. It's not. It may not be all you. If the relationship does not work, and this is any relationship, it's not going to bloom. You're not going to get the results that you need because you don't feel comfortable, in that energy exchange with your therapist.
I love that. And the fact that you are telling people that they should be interviewing essentially the therapist. And one thing that I love to talk about with patients is feeling empowered in and being a partner in their healthcare. And so your mental health is a part of your overall health and wellness. So we should take the same approach even when looking for specialists and experts to help us in our mental health needs.
And I'm gonna say this, and I don't want to jump on this bandwagon, but we have to stop being passive about our healthcare. We have to stop feeling like just because someone has a title, they know everything. There are some things that I have to walk out and I have to ask questions, because I get clients from different cultures, different religions. And if there's something that I don't know, I will ask them, like, can you educate me on your religion? Where can I read up on so that I can be more knowledgeable? I don't know everything. No doctor knows everything. And so when we walk in there, we have to have a list of questions that we need answered before we feel comfortable saying, I'm going to hire you as my doctor, because that's what it is. You're hiring them as your doctor. Like, you're paying them. So that's your money, that's your time. You need to be empowered in your healthcare. And that's something that I really, really want to, if I don't stress anything else today, we have to be active. We have to be an active participant in our healthcare.
Absolutely. Gone are the days that we just sit down and someone just tells us and that's it. It's a relationship.
Right.
Yeah. Oh my gosh. So something else that I took away from this is that not just seeing a therapist when things are bad. So I have a therapist and I have not seen her in a while. My grandmother passed away. And so I was going through some grief counseling. That was my crisis at that time. And so thank you for what you said, because even for me, I need to check in with her. It's been months since we've even communicated. So I need to reach out.
Absolutely. So I have my clients, we talk about phases. So when you're in crisis, that probably means I probably need to see you once a week. When you're stepping down out of crisis, maybe once every 2 weeks, then we start talking about maintenance.
Yeah.
I have clients who still come to see me, for years, once a quarter, once a month, because just to check in. They just want to make sure, I need this just to make sure I'm maintaining, because I don't want to take some steps back. And sometimes
and be in crisis again.
Absolutely, absolutely. So we call it maintenance, and again, we're actively participating in. So I asked them, okay, so here are your goals. Like you've achieved those goals. Like that's no longer an issue anymore. So how do you feel you are right now? Do you feel like you need to come and see me as much as you've been coming to see me? And sometimes they say, yes, just give me another, couple of months. And sometimes they say, you know what? Let's do every quarter. I think I'll be okay with every quarter.
Okay, I'm gonna do that. Once we wrap this up tonight, I'm going to send an email so that my therapist has it in the morning. Because like you said, this is a part of my life team. I have a financial advisor, I have a stylist, I have a manicurist, a makeup artist, and my therapist needs to be on my schedule, on my calendar regularly.
Priorities. We put so much more into our acoustics.
We do.
But that means nothing if our energy is off. You can be as pretty and gorgeous and hair with all that. But if you're not good with yourself, if your spirit life, if your mental health is not balanced, like what for what?
It does. All that other stuff doesn't even matter. Absolutely. You could be a beautiful mess,
Right. Next question.
So we're gonna do one last question and then we're gonna wrap this thing up because I could talk to you all night, but I know my boundary. We set a time limit and I'm gonna respect that because I know there's a consequence.
Right. What is that? It leave meeting. I'm just
right. I don't know if she's done, but I'm done. Goodbye. So this is the last question. So in life in general, we deal with a lot of traumas and tragedies. So, coronavirus is one that is kind of bubbled up and it's amplifying a lot of things that are lurking under the surface just in our world anyway. But loss, tragedy, and pain is something that all of us, struggle with and deal with. So what is something that we can do? I know we need to see a therapist, but like in our day-to-day life, with kind of, navigating and maybe trying to more effectively manage some of the byproduct or the, remnants of this tragedy and loss and pain that we just experience day to day in this life.
Right. The best thing to do is to not cover it up. I love this analogy of a soda bottle. I use it all the time because you can use it in so many different, scenarios, but it's almost like a soda bottle where you just keep shaking it and you keep shaking it and you keep shaking it. And then at some point when you open it, it's going to explode. Right. And so that's kind of what we do most of the time. Like we just kind of keep suppressing and keep suppressing and keep suppressing. And we use those distractions. I feel, but I'm going to go to work. I feel, but I'm going to do this. I feel, but I'm going to drink. I feel, but you never really say, okay, let me push all that aside and let me just feel. Right. Every emotion is energy. It's energy in motion. Right. That's what I call emotions. Okay. That means that you got energy just moving around inside of you all the time. And if you don't release that energy, it's going to get trapped like that acid in that soda bottle, and it's going to shake up and and you're going to explode. Like not literally, but you're going to be overwhelmed. You're going to feel like, the word nervous, but you feel I'm having a nervous breakdown. That's because you have not given yourself time to feel, so that when you feel and you sit with those emotions, when you sit with that energy, you're able to kind of let it settle so that you can release it. Whether that be meditation, whether that be, just sitting in silence, just allowing your thoughts to kind of get together. I know, some of my clients have told me that time from work to home, sitting in the garage, playing music for like 10 minutes, allows them to decompress, helps them with that transition from work to home and then back again from home to work. Whether it be listening to podcasts, whatever it is that allows you to decompress that energy so that you can feel it, but you need to release it. Right. Okay. So that's the key. You have to release that energy.
Have to release it. Wow. Well, Fab Squad, that is our time. I have thoroughly enjoyed this edition of Live with the Fab Squad with Dr. Audrey, talking about how to create and maintain boundaries and more. She gave y'all a whole lot of extra nuggets, right?
I talk too much. I don't know why you gave me a topic.
I love it. Thank you so much for saying yes. Thank you for being here. And I know you helped me, and just looking at the comments, I know that this this episode has been a real blessing to so many people. So mission
thank you.
accomplished. Yay.
Well, thank you. Love you, love you, love you. Love what you're doing. My yes machine would never turn off for you, and you know that.
Thank you, ma'am. I appreciate you. Enjoy the rest of your day, Dr. Audrey.
All right.
And until next time, bye, Fab Squad.
Have a good one.
Bye.